Throughout the presentation, we will discuss the definition and the description of what breast cancer is. We will discuss the symptomology, the diagnostic methods, the treatment, and then we will conclude our presentation. In this slide, I will talk about what breast cancer is, and I will also describe breast cancer. So breast cancer develops when abnormal cells begin growing rapidly and form a mass or a tumor. It is also important to note that some lumps in the breast are benign and not malignant, which basically means non-cancerous. One of the questions I wanted to answer, and I asked myself while doing this, is where does breast cancer start and what areas can it affect? So breast cancer starts when the cells in the breast, such as the cells lining the ducts and lobules, begin to grow abnormally. And it usually and very commonly starts and spreads into the axillary lymph nodes, which are located outside of the breast in the armpit area. Cancerous cells can also spread and start in the internal mammary lymph nodes, which are the lymph nodes inside of the chest near the breastbone, and to the lymph nodes both above and below the collarbone. Breast cancer can spread to other parts of the body when the cancer cells get into the blood or the lymphatic system. So the lymph vessels carry lymph fluid away from the breast, and cancer cells can enter the lymph vessels and then start to grow in the lymph nodes, which will cause the cancer to spread. I also asked myself another question: what are the different types of breast cancer? Most breast cancers are actually carcinomas, which means that they are a type of cancer that forms in the epithelial tissue. The most common type of breast cancer are invasive or infiltrating dual carcinoma, also known as IDC, lobular breast cancer, and also ductal carcinoma in situ, or otherwise known as DCIS. Breast cancer can further be classified by certain types of genes or proteins that the cancer makes, which is why we have the different stages of cancer. And the different stages of cancer also help us determine how bad the cancer is and to where it has spread. The last question I asked myself and that I wanted to focus on was, who does breast cancer affect and is it hereditary? So breast cancer primarily affects women ages 40 and older, but there have been some cases, actually very few cases, where it has occurred in men. Most of the breast cancer that develop in women have no identifiable breast cancer risk other than their gender or their age. Breast cancer is also hereditary, so it could be a first-degree relative, which is a parent, a sibling, or a child, or it could be a second-degree relative, which is an aunt, an uncle, a grandparent, a cousin, and it's actually caused by a genetic mutation in the BRCA1 and BRCA2 genes. And what these genes do is help restore DNA and protect the body from cancer. But without these genes, and if they mutated, they don't do that, which causes the risk of breast cancer.
Symptomology. Breast cancer can manifest itself in different areas.
In this slide, we will talk about the different diagnostic methods that are used to diagnose breast cancer. So how can breast cancer be diagnosed? Breast cancer can be diagnosed through a breast exam, a mammogram, a breast ultrasound, a breast MRI, MRI, or a breast biopsy. A breast exam is usually done during a routine visit or a checkup, and physicians usually check if there's any change in color to the skin or nipple, as well as palpating the breast, the collarbone, and the armpit for any lumps. The physician could order a mammogram, and a mammogram is basically an x-ray of the breast tissue, and they're commonly used to screen for breast cancer. A breast ultrasound could also be used to screen for breast cancer. It can give more information about the lump or the mass in the breast. So an ultrasound uses sound waves to make pictures in the body, and using an ultrasound shows if the lump in the breast is more fluid-filled or solid. Another way breast cancer can be diagnosed is through a breast MRI. And a breast MRI is a machine that uses a magnetic field and radio waves to create a picture of the inside of the body. In order to get a clear image of the mass or the lump in the breast, a dye is usually injected before the MRI, and it can show up if other areas are affected with tumors. The next thing that could happen if diagnosed with breast cancer is a breast biopsy. So there are two different types of biopsies that can be done. The first is a surgical biopsy, which involves making an incision in the skin and removing a part of the abnormal tissue. Or they could do a excisional biopsy, which is just removing the entire area if it is a smaller mass or a tumor that can be removed easily. Another type of biopsy, and this is actually the most common type of biopsy performed, is a core needle breast biopsy. And this type of biopsy uses a very large needle that is inserted through the skin and into the mass. They draw a little bit of the mass, and then they mark the spot with an X with a magnetic marker to show where they took the sample from, and it will also show up on X-rays. After the biopsy, or usually the biopsy, it goes into the lab where it's tested, and if it comes back for positive for breast cancer, it's then staged. So what are the different stages of breast cancer? So there's stage 0, which means that the cancer is non-invasive and it has not spread to other parts of the bodies. It's usually kind of localized. Stage 1 means that the cancer has been found in nearby breast tissue, so it has spread a little bit. Stage 2 is cancerous cells have formed a tumor or multiple tumors, and the cancer has spread to the underarm lymph nodes and measures between 2 to 5 centimeters. Stage 3 breast cancer is referred to as locally advanced breast cancer because it is found in nearby tissue and lymph nodes. And stage 4 breast cancer has spread from the breast to the liver, the lungs, the bones, or the brain.
There are many treatment options, including surgical treatment options, radiation therapy, chemotherapy, targeted therapies, and hormonal therapy. Surgical treatments include lumpectomy, which is breast-saving surgery. This is when there is an ability to remove the lump from the breast. The next option is a mastectomy, which can be categorized as a simple or modified radical. This is when they remove the entire breast, including lymph nodes. This is a very invasive procedure. Other surgeries include sentinel lymph node biopsy, which uses radioisotope dye, and axillary node dissection, which is the removal of 10 to 20 axillary nodes. Radiation and chemotherapy include external beam radiation therapy, brachytherapy, taxanes, and platinum-based therapy. Brachytherapy is when a radioactive seed is placed into the breast cavity. Now, chemotherapy is different as this can be given intravenously and is given to patients who are at a high risk, early stage, or patients who need to shrink tumors before removal. Targeted treatments can include HER2, PARP inhibitors, CDK4/6 inhibitors, and hormonal treatments can include SERMs, which is selective estrogen receptor modulators, aromatase inhibitors, and ovarian suppression ablation. In conclusion, breast cancer still remains one of the most significant global health challenges, but knowledge, awareness, and early intervention can continue to shift outcomes in a positive direction. Understanding this disease from its definition and risk factors to symptom prevention, diagnostic methods, and treatment options is essential for improving survival and quality of life. By recognizing subtle early signs such as breast lumps, skin changes, nipple alterations, or localized discomfort allows individuals and providers to take immediate action, often leading to earlier diagnosis and more effective treatment. Advancements in diagnostic imaging, biopsy, and genetic testing have made these early detections increasingly achievable. While modern treatments, including targeted therapies, precision medicine, hormone therapy, radiation, chemotherapy, and improved surgical techniques, offer patients more individualized and effective care than ever before. Each treatment plays a crucial role in halting disease progression, reducing recurrence, and extending lifespan. Ultimately, awareness and education empower both patients and healthcare providers. Early identification paired with prompt and evidence-based treatment can be life-saving. Breast cancer may be a complex, multifaceted disease, but with the continued expansion of research, improved medical technology, and increased public awareness, individuals have a greater chance of survival and long-term wellness. The more we understand, the better we can protect ourselves, our families, and our communities.